You've seen it a million times. In pretty much every hospital room, on every ambulance, there's that clear bag of fluid, the one that saved more lives than almost any other substance we have. And yet, its main ingredient is probably sitting on your dinner table right now. Today, we're pulling back the curtain on the hidden power of that unsung hero, sodium chloride.
So let me ask you something. If you had to guess the single most widely used drug on the entire planet, what would you say? Maybe a famous painkiller? A breakthrough antibiotic? Well, the real answer is probably not what you'd expect at all.
Believe it or not, it's salt. Yep, simple, ordinary table salt. But that just begs the question, right? How in the world does this everyday seasoning get transformed into one of the most powerful tools in a doctor's entire toolkit? Well, that journey from the kitchen to the clinic is a complete game changer. We're not talking about the same stuff you put on your fries, not even close. This is pharmaceutical-grade sodium chloride. It's purified to an incredible degree, totally sterile. It's basically a precision instrument. And this is where the magic really starts. As soon as that pure salt hits the water, it splits apart into two charged particles, these things called ions, sodium and chloride. You can almost think of them like the positive and negative ends of a tiny battery. Sodium, it's the master regulator of our body's fluid. And chloride is absolutely essential for keeping our internal chemistry in perfect balance. It's this very separation that unleashes all of its medical power. Okay, so to really wrap our heads around how these solutions work, we need to get a handle on one really core scientific idea. And that concept is called tonicity. Look, in simple terms, tonicity is just a fancy way of describing the saltiness of a solution compared to the fluid that's already inside our own cells. And why does that matter so much? Because this difference in saltiness is exactly what tells water where to go inside our bodies. And you know what? Controlling water is fundamental to medicine. So here's the crucial part. We actually tailor the tonicity for different jobs. Isotonic saline, like the 0.9% normal saline you see right there, has the exact same salt concentration as our blood. That makes it perfect for just basic hydration. Now, hypotonic saline is less concentrated, so it gives the body water without a big salt load. And hypertonic saline? That's the heavy hitter. It's way more concentrated, and it's a powerful tool that's designed to literally pull excess water out of our cells. 3 different strengths for 3 very different jobs. But here's the thing. Sodium chloride isn't just for IVs. That same principle of tonicity makes it an incredibly versatile tool that shows up in all sorts of places you might not expect. Of course, in the veins is where we see it the most. That 0.9% normal saline is the absolute workhorse of every single hospital. It's used for everything, from treating dehydration to being the vehicle for countless other IV meds. The other strengths, like half normal and hypertonic, they're more like specialized tools for really serious conditions, like correcting dangerous imbalances in the body. But its use goes way beyond the IV bag. I mean, have you ever used a saline nasal spray when you have a cold? That's sodium chloride. It can be inhaled through a nebulizer to help people with conditions like cystic fibrosis break up really thick mucus in their lungs. And it's used as a sterile wash to clean out wounds without damaging the tissue. It is a remarkably adaptable tool. All right, so we know it comes in different strengths, different forms, but how does it actually save someone's life in a critical moment? The answer lies in this fundamental power called osmosis. It all boils down to one simple, unbreakable rule of biophysics. Water always follows salt. Think of it like this. A concentrated salt solution is like a powerful, thirsty sponge. Wherever you put that sponge, it's going to draw water towards it. So by precisely controlling the salt concentration in a patient's bloodstream, doctors can essentially tell the water in the body exactly where it needs to go. And this principle is never more dramatic than in a true life or death situation. Just picture this. A patient comes in with a traumatic brain injury, and their brain is swelling dangerously inside their skull. Time is absolutely critical. So doctors administer a concentrated, hypertonic saline solution. Instantly, the blood flowing through the brain becomes much, much saltier than the swollen brain tissue. That sponge effect kicks in, and water is rapidly pulled out of the brain cells and into the blood vessels. The pressure inside the skull drops. It is a breathtaking use of pure physics that can, literally in minutes, pull a patient back from the brink of death. But here's the twist. For a substance that seems so simple, it is an incredibly potent drug.
And what that means is that using it is a very delicate balancing act because getting it wrong can be just as dangerous as not using it at all.
This is why clinical judgment is everything. I mean, while saline is life-saving for someone who's in shock from losing blood, giving that exact same fluid to a patient with congestive heart failure whose body is already overloaded with fluid, well, that could be catastrophic. It is never, ever a one-size-fits-all solution.
And when things go wrong, the consequences are serious. Too much fluid can literally make a patient feel like they're drowning as it starts to fill up their lungs. These imbalances can send sodium levels skyrocketing or cause potassium to plummet, which can affect the heart. In fact, just giving large volumes of so-called normal saline can actually disrupt the body's entire acid-base balance, a condition called hyperchloremic metabolic acidosis. It's this very issue that has sparked a huge debate in medicine, with a lot of experts now arguing for more balanced fluids that are closer to our own plasma.
Which brings us to probably the single most important takeaway of this whole thing. And it's captured perfectly in this quote. It is never a benign fluid. It is a powerful therapeutic agent that when used appropriately is life-saving, but when misused can cause significant harm. It's not just salt water. It's a drug.
So the next time you see that clear bag of fluid hanging by a hospital bed, are you going to see it as just salt water? Or are you going to see it for what it truly is, a precisely formulated, incredibly powerful, and life-saving drug? Just remember the power it holds and the delicate balance it takes to use it right.